Hi, VChip. Chris, Rachel, and I are excited to be here today. Measuring what matters can be a universal quality improvement challenge, and for some people, talking about measurement or even thinking about measurement can feel really intimidating. So, with our combined perspectives and decades of experience, we're going to walk you through how to move from improvement ideas into measurable action. And there'll be something for everybody that's watching this. So, something that you all can take away today and bring back to your teams. And really, we want you to sit back and think about today's session as a roadmap. We're here to help you set a direction, help you choose good measures, and then thinking about how to use your measurement plan to make decisions on what you're learning as a team. I'm sure many of you have been part of a project where the measures didn't exactly match your goal. And so after today's session, you're going to leave knowing exactly how to build that measurement plan that aligns with your improvement goals. And more importantly, you're going to look at how to make those measures meaningful and not just numbers that you're tracking because you have to or because someone told you to. As you look at this slide, you can see that these are about like the six classic steps to any quality improvement project. But today we're really going to zoom in and focus on the essential part of the process, which is measurement. And measurement really threads through every one of these steps. It helps your team define a problem. It helps you understand the gaps. It helps you test changes. And then ultimately, it helps you and your team know if you've made an improvement or if you're being successful. Often teams jump right to solutions, but without having the right measurement plan or the right measures in place, it's really hard to learn, adapt, or prove that your project is being successful. So again, today it's really about thinking about and talking about and choosing measures that are going to matter to you and your quality improvement project. W. Edward Deming was one of our early QI pioneers, and his philosophy really frames QI as both a or as both a science and an art. So it's really thinking about how QI blends the rigor of measurement with the art of understanding human behavior. So the data and the theory really tells us what's happening, within the system, but it's the teams and the people and the engagement and the creativity that really tell us the why or really tell us the story. And this is why interdisciplinary teams are really important when it comes to quality improvement because each person has a role and sees the system from a different angle or a different lens. And that really is where that art comes and really can help with the methods and, the science of QI. The model for improvement is used extensively in healthcare organizations to help guide this systematic testing, our learning, and our scaling of successful improvement work. The model for improvement is intentionally simple, and it starts with curiosity. So, what is the problem that we are trying to solve? Then we look at our best practices to define the gap between what the current and the ideal state is in the system that we're looking at. And measurement sits at the center of this and really helps guide our learning through iterative PDSA cycles. And everything that we measure should ladder up to at least one part of the quadruple aim. So thinking about what is it that we're trying to achieve? Is it a better patient experience? Is it better population health? Is it lower health costs? Or even better provider well-being. And the other piece that we want to address is health inequities in the system. So again, thinking about laddering up a measurement plan that addresses at least one part of this, the quadruple aim, and including equity in that as well. So in short, the model for improvement guides our methods, while the quadruple aim guides our goals. Without really having measurement, you're really flying blindly. So we always like to say measurement is the engine that sometimes drives our improvement work. When it comes to quality improvement measurement, measurement isn't for judgment, but it's for learning. So our goal is not to have perfect data, but rather just enough useful data to help us make a decision. So it gives us real-time feedback and helps us understand whether we should continue to move forward with an intervention or a change, whether we need to adapt it, or whether we think that we need to abandon it altogether and try something new. So again, it really helps us understand and gives us that real-time feedback. One area where teams get tripped up a little bit is thinking about quality improvement, measurement for quality improvement versus a measurement for research. And, there is a difference. So in quality improvement, it's about bringing new knowledge into your daily practice, where research is really discovering new knowledge. Quality improvement measurement is iterative. You're working on small, rapid cycles that are designed to be imperfect and designed to help you learn. Improvement thrives on just enough data, while research is really rigorous. It's really controlled, and often you're looking at a large amount of data. And again, the quality improvement is just a little bit different. Again, some examples are in quality improvement, you might be looking at 10 to a dozen charts in a month for a chart review, whereas if you were doing a controlled research study, you may be looking at 1,200 charts a month. All right, and now I am going to turn it over to Chris to lead us on with the rest of our presentation.
Thank you, Alyssa. So the first step in your quality improvement project is to set your aim. So the global aim and the specific aim, which you'll work on with your QI team, is very important. The global aim helps you to set the direction for your project. What is it that you're trying to accomplish? Getting back to that first question in the model for improvement that Alyssa talked about. The specific aim will help you to narrow the focus and to define the success of the project. So agreeing on the aim is really crucial to success in quality improvement. And the team will be more successful if the aim is clear. So one acronym that we use to help with developing your aims is the SMART. You may have heard of that before. So SMART is that your goal should be specific. So what is it that you're trying to improve? It should be measurable. So we're going to be getting into measures later. How much is it that we want to improve? How much do we want to improve? It should be attainable, achievable. So what does success look like? Relevant. Why are we doing this work? Why is this relevant? Why now? And time-based. When are we going to complete this by? The next slide is talking about who your team is. So in order to have a SMART aim, you need the right people to develop it with you. So there are different kinds of teams, and quality improvement teams really are unique and a lot of fun when you start getting into it. So there are some critical success factors to teams. Quality improvement teams. Who is your sponsor? It's really important to have a sponsor for the team, and we are really lucky at VCHIP. As you know, we work with Vermont Department of Health and Family and Child Health, and they are wonderful partners in this work with us. You want a team to help you to focus on the why, because you always want to start with your customer. Quality improvement is about making important, sustainable changes that improve the outcomes or processes for your customer. So having customers, patients, families, clinicians, thinking about who your customers and having them on your team is very important. Team members should provide a complete view of the system that you're trying to change. They should help you develop your measures so they understand the processes is important, and having the right quality improvement tools along the way and methods is important as well. So when we move to the next slide, this is a framework that we use across our projects to help you to define and understand your global aim and your specific aim, because this is the first task that you're going to be working on as a team. And again, making sure that people who will benefit from this work are helping you to co-design the aim is really important. So walking through this framework, what is it that you aim to improve? So naming the process that you're looking to improve. and to get more specific in terms of where does this process begin and where does it end. So this will help you to focus on the systems and processes that need improvement. It helps you to avoid scope creep. It helps to make sure you're not focusing on non-critical areas, but really focusing on where you want the change to happen. Sometimes the team will need to develop a flow diagram of what they're talking about and try to improve to help them to understand where it starts and finishes. What are the benefits of doing this now? So again, why is this important? And why is it important to do it now? So for the specific aim, this helps you get more focused, as we mentioned earlier. So what are you going to improve? You're going to increase something, decrease something? What is it? Are you going to do it by a certain number, percentage, quality, and when are you going to do it by? So the next slide is an example of a global aim and a specific aim from a specialty clinic who was looking at improving their scheduling. So they're going to improve patient access in dermatology. That's the location. The process begins with when the patient calls in for the appointment, and it ends when they've been evaluated in the clinic. By working on this process, we expect decreased appointment backlog, improving patient satisfaction with the scheduling, and improving staff satisfaction, and why this is important. So it's clear that this team had some information, some data, and data really drives quality improvement. It drives measurement to say why it was important and to say what some of the gaps in care were. So they had data to figure this out, to understand that more, and then they were able to get to a specific aim so that they identified that they wanted to reduce the backlog by 50% by a certain time. In this case, June 1st, 2026. Setting those targets is talked about in this next slide, because that can be a really difficult thing for a team to do. It looks so simple in that last slide. Oh, 50%. But that really, they came to that because they had done some research, they had some data, they had some information to help them understand what was made the most sense as a goal or a target. So when you're looking at setting your target, you want to ask, are there some established benchmarks? Do your funders or your partners have some specific goals that they want you to meet? Do you have data for your baseline? If you do, that's great. Are you looking at an absolute goal, a fixed target? Like, we're going to improve this. In that case, it was 50%, or relative, like a certain percentage over your baseline, for example. You want to be sure that you're setting rational numerical goals. You want to make sure that there's a clear line of sight between the theory of what changes are likely to result in improvement, the resources that have been allocated to the team, and the numerical goals that you set. You can set a stretch goal, but keep in mind that a stretch goal is looking at big changes to a system. It might be redesigning a system. Sounds like a lot of fun, but that's a different thing. And if you're going to do that, make sure you're communicating it clearly with your team and immediately, and be ready to say, oh, geez, this maybe we bit off a little more than we can chew. Maybe we want to look at a specific part of the project, of the system. Maybe that will be a better place for our team to be. So going to the next slide. Once you've defined your aim, how do you move from a well-written aim to the set of measures that we really want to focus on during the next half of this talk? What are the key drivers that will move you to success? And how do you select measures that are aligned to those drivers? Well, lucky for all of us, look at the next slide. There is a tool. There is a quality improvement tool that you can use for this. And it's called a key driver diagram. Some of you may have already used one. So it's a great tool that will help you to do just that, to give you a roadmap for change. It's a tool that will guide your team as you build and test your theories for improvement. It can help you answer the question, what changes can we make that will result in an improvement? And it's the collective knowledge of your team that represents the shared theory of how things could be better, and builds your knowledge gleaned from research, from observation, and from experience. The next slide is a view, a pretty busy view of the key components of a key driver diagram. that will help you move from what your aim is on the far left to moving through to a completed driver diagram, which will really help you to move to your measures. So moving from left to right, moving from your aim, which is the Y, you move to the right, and everything to the right answers the questions. It helps you to understand what must change and how it must change. So it's the what and the how of the aim, which is your Y. So the primary drivers, which are to the right of the aim, those are the key structural areas, high-level elements in a system. Those are your major processes, your operating norms or rules, your structures. And we like to have no more than 5 key drivers because it gets way too complicated if you start to have too many key drivers. Your secondary drivers are those elements or portions, the places, the approaches, where in your system the change can happen. These together, the primary and secondary drivers, are your key leverage points in your system. Then you get to move, or you can move into, and this doesn't happen just iteratively or in a sequence necessarily. You can kind of go back and forth with this as you're completing it. So what are some changes that your team believes are improvement that can help to improve your system? And you can start to brainstorm or think about, or with your knowledge or observations, what are some specific changes that could help with that? What are your ideas? Or you can also use change concepts, which are more abstract, but they can help you to identify what those specific changes are. For example, you need to improve your workflow, or you want to do some more cross training. But what does that really mean? What's the idea? So those things can help you to identify those specific changes. A key driver diagram is the most best used with a way to learn. So that's the model for improvement that we use, a way to test your changes, as Alyssa talked about earlier, that this is you're looking at the system and you're trying things out and seeing if they work or not. Given that, key driver diagrams are living documents. So you keep it dated, because as you're working with your team, you can make some changes, because that's what sharing and learning and knowledge is all about in quality improvement. And so now this next slide is an example of a key driver diagram, again, from a past project. And as you can see, the aim was to, by December 1st, 75% of 11-year-olds will have received 1 dose of the HPV vaccine. So that's great. So 2 very important key primary drivers. You need a standard process for vaccination and increasing the opportunities to administer them. So this team discovered that the ways that they can achieve those primary drivers is through having an effective process for identifying patients, having a universal vaccine schedule, increasing the adolescent well-visit attendance, and offering vaccine at all visit types. And then here's some great change ideas that the team came up with that they then tested as part of this project. So given that, Rachel is now going to talk more about how do you then move to your measures.
Thanks, Chris. So once you've set your aim, you've come up with your theory of how you're going to achieve that aim, you want to think about how you're going to measure it. And in QI, we can think of 2 levels of measure. You're going to have your project measures, and those are I kind of think of the big measures. They're how you're measuring kind of the end of the project. Did you achieve your aim? Did you implement the big strategies you want? If this is a multi-site project, these are the measures that are going to be used by all participants in the project. But then you're also going to have measures associated with each PDSA cycle. So again, if this is a multi-site project, each site might have different PDSA cycle measures depending on what they're testing at their specific site. What change concept are they testing? So what do they want to measure in that specific PDSA cycle to see if that little hypothesis was correct or not? These are really used more for that internal team learning to know which changes resulted in improvement. And then those project measures are really more to evaluate the project. So on the next slide, we talk about how do you come up with these measures? So I think the first question we always ask ourselves when we're thinking about a project does a validated or an endorsed measure already exist? And we'll show you in one of the next slides kind of where you can look for those. But that's always the first place we look, because if there is, often practices are already measuring using some of these validated measures. So if they don't have to duplicate measurement, that's always a plus for practices. But what if there isn't an endorsed measure already available? What do you do? So places that we would start to think about developing measures is first do a literature search on that topic. What evidence does there exist? What changes? What things are other folks doing in this area? What measure that are they using that you could use or adapt for your project? We'd also look at best practices from various professional organizations. So perhaps AAP or ACOG, what are they recommending you measure and use for your specific topic? And then you'll look to your content experts that you're working on this project. What do they think is really important to measure and evaluate as you go through this project? The next slide shows you some of those child health measurement sets that are available for when you're looking to see if a measure already exists. These are some places, good places to start your search. I'm not going to list all of these, but they all have their measure sets posted online. And like I said, a good place to look for to see if something already exists in the area where you're doing your work. The next slide will talks about the different types of measures we think about when we're doing quality improvement. And there's three primary categories that we'll think about: outcome, process, and balancing measures. And they each look at different elements. So outcome measures are really kind of the voice of the customer, we'll say. What is the project result that you're trying to achieve? What is that outcome? Often it's a change in individual or population health outcomes. Process measures really look at the process and evaluate whether the steps in the process are working as they're intended to. So they're really evaluating the function of the system. And then balancing measures look to see, while we're making these changes, while we're doing this QI work, are there unintended impacts on in other places in the system? So that's looking at the function of the system as a whole. In the next slide, we have some examples of each of these types of measures from our flu vaccination project. So the outcome or goal of this project, the outcome measure, was the percent of patients who received flu vaccine. One of the process measures were the percentage of encounters where patients were offered the flu vaccine. So you can't get the vaccine unless it's offered. So we want to make sure that that process is happening. A balancing measure that was looked at was the rooming time. Did the added step of providing the flu vaccine increase room times? Was room turnaround slower? Were patients waiting longer to get into rooms? So you want to look to see if this effort to increase flu vaccine and the processes that were implemented were having effects elsewhere in the system. So the next slide shows how you can really use that key driver diagram to help you think about what measures are going to be important in your work. So I love the key driver diagram because I feel like everything is in it. It has your aim, it has your ideas for change. It guides you in creating your measures. It guides you in what kind of education or information you need to provide your participants. It's really just this holistic view of your project. So if we go back to the key driver diagram Chris talked about, the HPV vaccination, we can think about some measures that were associated with this project. So we want to be measuring the aim. That's our outcome measure. So we have the percent of 11-year-olds that received one or more doses of HPV vaccine. One of the process measures or two process measures are shown here the percent of adolescents who received a reminder notice and scheduled a well visit. So that's associated with this increasing adolescent well visit attendance. So we can't give the vaccine if adolescents are in the visit. So for practice was we are trying to get practices to get adolescents back in the visit, back into the clinic for their visits. So we're going to measure that. How effective is that process? And then uh, tied to this other secondary driver, offer vaccine at all visit types. We're going to measure the percent of adolescents who are vaccinated at non-well visits. Um, so this is you can really use your key driver diagram to identify what are the important things to measure for your project. The next slide talks about a family of measures. So when you're doing a project, you don't want to have just one measure because we know systems are complex. So we want to be looking at several measures so that we can kind of capture the complexity of the system. You don't want to have a lot. We often think of like 2 to 8. You want to fit them on one page. We often will have dashboards showing these families of measures so that you can easily see your progress in achieving your goals. And you want to include that mix of process, outcome, and balancing measures. So on the next slide, we have an example of a family of measures, again, from that HPV vaccination project. So we have one that was measuring missed opportunities. So again, one of the things was you want to increase the opportunities for giving the vaccine, so offering it all visits. So we have that, and you can see in this chart, we have the practice in green, and then we have the aggregate shown in blue. Sometimes if you have an absolute goal, that's also good to include on these run charts so people know where they're going. In this project, it was a relative goal, so each project was trying to increase by 10% over the baseline. But also you can see on these, in the upper right-hand corner of each chart, it's telling you which direction are you wanting to move this metric, up or down. So this was showing a variety of measures, those missed opportunities, the series initiations, the process with which charts had those provider prompts, and then looking at the reason why patients weren't getting vaccinated to better understand what was happening in the system. So next slide. Once you have identified your measures, you want to create operational definitions. And that is where you define the numerator and the denominator. You agree upon what are the criteria for what counts. So that includes who's going to be included and who's going to be excluded. You'll decide what kind of sampling plan you're going to use. And then you define the unit of measure and level of precision that you're going to use. These are really important, especially when you have are working across multiple sites or maybe multiple kind of chart reviewers to make sure that everything is being counted similarly. So the next slide shows a family, some operational definitions of the ADHD measures from a recent CHAMP project. And you can see for each measure, they have the name. It describes the measure, it sets the goal, defines the numerator and denominator, and chart review, and the source of the data. And then in the next slide, we just want to kind of talk about some of the pitfalls and tips. So often in quality improvement, there's people can get hung up waiting for perfect data or feel like they have to get more and more data. Really just start with what data you can get. And don't feel like you have to have a ton of data or measure too many things. You really want to focus on what is relevant to your aim. And then another pitfall is really developing those measures in isolation. This is where that team that Chris was talking about is really important to have that whole team engaged and everyone who touches that process to think about what are those important measures to capture in your work. The next slide just summarizes our key takeaways. So keep patients and family at the center of all your work. You want to start with that aim, both that global and then that specific aim. Working with your team through all of this, you want to make sure that your measures are aligning with your aim, that you're choosing that mix of measures, outcome processing and balancing. And remember, the reason why we are measuring is for that learning and improvement. This isn't for judgment or anything like that. It really is, how can we learn? What did we learn from this? And then remember, QI is dynamic. It is not static. So once you've created your key driver diagram, it's not check, put that aside. You're revisiting that as you go through the project and modifying it as you learn more. You may need to adjust your aim if it was maybe too stretch to make it more realistic. All of this, as you learn and you want to apply your learnings for your future cycles and your work. So it's not a one and done. It is a continuing process of reevaluating what you know and applying it as you move forward. So our references are shown on the next page. And that is it for our Aims to Measure project presentation.
Thanks everyone for watching, and we hope that you have taken away a couple different nuggets that you can bring back to the team and apply to your own quality improvement project. And we look forward to hearing more about your projects and the work that you're doing, and we'll see you another time for another QI lesson. Thanks everyone.
Bye.